This amazing patient came to me just wanting a slightly more refreshed and younger appearance. Now you can see she's already young, but her fear is that she doesn't want to keep doing fillers over time because she's seen friends around and what happens if you keep doing fillers. Now, fillers are a great thing and we use them to make small, tiny little adjustments on the face. However, there are practitioners or patients who do these things as maintenance and they keep adding filler over time and you get what we call filler fatigue. Filler fatigue means that the face is just getting tired of it and it tends to grow larger and bulkier over time while changing its character overall. She doesn't want that. She wants to maintain a natural appearance as much as possible, and in doing so was avoiding putting excess fillers. But it wasn't getting her to the point where she wanted to be, so we decided to do the Aura Lift. The Aura Lift is a modified deep plane type of face and neck lift that can produce a very natural result. More and more over the past years, we do see that patients are getting younger coming in for facelifting, and this is not necessarily a bad thing. In the past, we would reserve facelifts for patients who are over 55, 60, 65 years old, waiting till they got to the point that they had to do it because there was going to be some sort of trade-off or awkward appearance that happened with these pulled, stretched, stigmata type of facelifts. Nowadays, we're using these deep plane techniques, and the better you are at the deep plane, the more natural result you can get. The Aura Lift gives the most natural type of result. So now, rather than thinking this is an age-related procedure, we're looking at the mechanical changes that you can make. So if you look at someone's face and think to yourself, I can't make the proper improvements with filler or with radiofrequency or with laser, we do have the option of facelifting where we can physically go take droopy tissues and put them back up into place. In a patient like her, she does not look old at all. She looks beautiful, she looks young, and realistically, most people would look at her and say, you do not need a facelift. However, in this case, there are some internal laxity issues that aren't necessarily seen outside that I do see. And I know that if I do the Aura Lift on her, I can get this nice natural type of rejuvenation that'll make her look brighter, make her look younger, make her look more fresh without the need to put as much filler. Now, she still can go do filler, she still can go put little bits of Botox here and there. This just makes it a lot easier and will keep the face more delicate as she ages. Although cost alone in doing procedures shouldn't be a major factor, it really is for some people, and we do have to worry about the practicality of this. Some patients would be better off, rather than wasting time and money, just to go do the bigger procedure first and then age more gracefully and easily from that point with less maintenance that needs to be done with other radiofrequency or injectable type treatments. Whether we're talking about injectables, radiofrequency, laser treatments, or surgery, it really depends on who's doing the treatment and what kind of result you're going to get. If you do fillers for a repeat amount of time, you may look perfectly natural depending on the injector, or you may look perfectly fake. The same is true with surgery. With the Aura Lift procedure, after about 3 months, it becomes nearly imperceptible to even a twin of the patients that I've done, meaning that even though we've done a surgery, we've done a major type of lifting procedure, even their twins, their siblings, their parents, their cousins, closest friends cannot tell anything was done. And that is when they're staring at them straight in the face, even if they have the exact same face like a twin would. This patient is incredibly beautiful, incredibly active, incredibly sweet. She has been used to looking really, really good, in shape, and fit her entire life. And now reaching the 50-year mark, there are some changes that she doesn't like to see anymore. And she saw that fillers weren't really helping her to the way that she wanted, and she wanted to see if there was another option that could be a little longer lasting, more delicate, and as natural as possible. For that reason, I looked at her and saw the little doughiness in the skin and decided to do the Aura Lift procedure for her, which, as you can see, made a beautiful change. And it's not a huge change, it's the appropriate change. And it's important to know this. Patients who come in, they're confused sometimes when they look at before and after photos, and they think that the patient that they saw in another before and after photo actually asked to look more extreme, more conservative, less conservative. In the hands of a good surgeon doing natural surgery, that's actually never the case. What we do is we release everything and we lift it to the place that it wants to go, which means you don't get a big lift or a small lift, you get the appropriate lift. And I've compared this before to shoe size, to pant size. You don't go short, you don't go tall, you don't go big, you get something that's exactly your size. And that's how plastic surgery should work, and that's how it worked for her.